How's it, guys, and welcome back. Today we're going to go through the theory and practical of how to take a blood pressure. This is a really important skill, so I would recommend that you get really good at this. Take everyone's blood pressures. So if you're learning how to do blood pressures, or you just want to do better at blood pressures, this is the video for you. Stick around till the end, and I'm going to tell you two little secrets that I think have changed the way I see blood pressures and the way I do blood pressures. So what is a blood pressure? So it's made out of two numbers. One is a big number, one is a small. The big number is your systolic number, which is a Greek word for contraction. So that's when the heart is contracting. That's the pressure. Then the diastolic, which is when the heart is relaxed, which is also a Greek word for dilated. So that's when the heart is not contracting, but rather relaxed. So that's kind of like the passive pressure. So those are the two numbers. I have a plastic pipe here. So why do I have a plastic pipe? Imagine this is the artery running through the arm that we're taking a blood pressure on. If we pump up the cuff and we put it over the artery, we can't hear anything, which is the same as if we have no cuff on. If you just take your stethoscope and put it on your artery now with nothing on your arm, you won't hear any blood because there's just clean blood moving through. There's no obstruction to flow, hopefully. If this is our artery and we have a BP cuff on and we inflate until the radial disappears, so our BP cuff is above the systolic number, and we slowly let go of the pressure, the artery goes from completely compressed, where we hear nothing, to then, as soon as a little blood can get through, we start hearing something. And then that is your systolic number. So that's when you start to hear your first Korsakoff sound. This is the funny word for these noises. And then as soon as that sound starts, that is your systolic number. It's your first number, so that's the high number, systolic, during contraction. Then you let go of the pressure, and you let go of the pressure. And as the pressure comes off the artery, and then once all the pressure's off the artery and the noise disappears, that's your diastolic. That's when it's relaxing. And so that's really what we're doing, okay? Like I was saying, if you put a steth over your brachial artery now, you hear nothing because there's no turbulence in that blood flow, and that's what we're listening to. So let's kind of go through how to do this. So you get different kinds of blood pressure cuffs. You get adults and kids and obese and all this thing. But you see how this one only has one pipe coming off it and has the gauge and the thing to pump it up with in one hand, which I prefer. Or you get these ones where you have two things coming off. This just gets tangled and then it falls and it's just a lot heavier. I don't prefer this because it's just more things to get tangled and wrong. But it is really important to understand how this little gauge thing works here. So if you just put it in your hand like this, you can rotate it like that, and you see how you can control it. So be really good at controlling it just with your index finger and your thumb opening and closing. Important to get good at that. But let's go to this cuff. How do we take a blood pressure? So the cuff goes on, the cuff goes to the level of your heart, right? If the cuff is above your heart, your blood pressure will be artificially low. And if the cuff is below your heart, your blood pressure will be artificially high. So the cuff needs to be in line with your heart. So if they're lying down, setting up wherever they are, if it's on their arm next to their heart, it's not going to be above or below. So just important things to understand. Handy stethoscope, got my Littman. So what do? Cuff is on, we're ready, okay? So as I inflate, I'm feeling the patient's radial. And I'm going to inflate until I can't feel the radial. So what is that doing? It means that the cuff has a pressure higher than my systolic number because there is no blood flow because we've completely pinched the pipe. Before this, we also need to feel the brachial artery. So this is just in between your elbow, just above your elbow. If you make the patient's arm straight like this, you see mine sitting right over here? You feel that because that's where the steth is going to go over. So what you do is you feel the patient's radial and you inflate, all right? Mine's at about 130. No, still. Once it's disappeared, you can add about 10. Then you put your stethoscope on. You put it over. You push and you then listen. I'm going to deflate a couple of millimeters of mercury a second. We're going to see what happens. So I can't hear anything. Okay, there, 130. This doop, 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 doop. Cool, yeah, it's changing a little bit. So it was 130 was my systolic. Can still hear it. Still hear it. Just hit 90. 80. There we go. So my blood pressure is 130/80. And that is how you take a blood pressure. I would recommend you just practice on everyone you can. Practice on your parents, practice on your friends, practice on everyone in your family. The more you do this, the better you get. So coming to those two little secrets. The one is, if you just want a quick systolic number, which is a really, really helpful, useful number, all you need to do is put the cuff on, feel the radial, and inflate until the radial disappears. So you inflate, and then you inflate high, and then you decrease until you feel a radial. There we go. And what that tells me is my systolic number. So I really don't need to have spent a lot of time doing this, and it can be done really quickly. It can also be done in a noisy environment. So that's part of the problem, is that sometimes we're in a moving ambulance, or we're in a helicopter, or we're in a plane, whatever we're doing, and putting a stethoscope on, putting it to the arm and trying to listen to these sounds can be really challenging. But if you can do that, you can get a nice systolic reading. Something that someone else taught me, which I really appreciate to this day, is that you can take a blood pressure without a stethoscope. So this is where the fun really starts. All you're doing is you're putting your fingers again on the brachial artery and you're feeling it, all right? And now, instead of putting a stethoscope there, you just feel the turbulence. So because we're listening to the turbulence, you can feel it. It kind of just changes the way that it feels. So if you inflate, let's see if I can do it. It's really hard to demonstrate this in a video, but I'll try. So I can feel my brachial. So I can't feel anything in my brachial. I'm going to decrease, decrease. There we go. Yeah, at 130, which is exactly where my systolic was. I can just feel this like loop, loop, loop feel. I'm decreasing, I'm decreasing. I can still feel it, I can still feel it. It just feels very different. And then that difference will then disappear, decreasing. And there we go, 83, maybe a bit higher than 80. So you see how that gave me an accurate reading, even though I wasn't using a stethoscope. So I tempt you to try this. Take someone's blood pressure using a stethoscope and listening to all the sounds. Write it down. Then try it manually with just your hands. Put your fingers on the brachial and increase it until it obviously disappears. And as you're feeling, it'll come back. That's obviously our systolic number, because the pulses come back. But then you'll feel that it kind of has this different kind of like pulse to it. It feels more of like a slap than really a pulse. And then that like slap feeling kind of disappears to like a normal, what a pulse normally feels like. Give it a try. That's definitely a little trick that I have been taught back in the day. So when you are with a patient who's actually really sick and you're in a moving ambulance, or it's a noisy ambulance, or whatever the case is, you can still take a relatively accurate blood pressure with just your hands and a BP cuff. So I would definitely recommend that if you are learning these things by your own BP cuff, by your own step. I'll put a link in the description. And then the other thing to like really just note is that a automatic BB cuff, like on a life pack or whatever the case is that the lower those blood pressures, the less accurate they are. So when we get low blood pressures on these machines, we really should be taking a manual, especially if we're going to be giving any sort of like inotrope. We should really be knowing exactly what our blood pressures are and not relying on a machine that can sometimes get things quite incorrect. So guys, thanks for your time.